FORA.tv. The world is thinking.
I guess I'd like to start off by highlighting that the two sides in this debate agree on a lot of things. Although we disagree on some things, we agree on a lot of things. We agree on the fundamental problem, which is the growth in health spending that doesn't provide good value for money. The average employer-sponsored health plan now costs around $12,000, and it's that is the engine behind the problem of uninsurance and the problem of affordability of health care. David Kessler, who's one of Senator Obama's key advisors, recently wrote a paper, in fact, showing that 2/3 of the growth in uninsurance over the past 10, 15 years or so is due to this kind of cost growth. We also agree on some of the solutions: more disease management, more health IT, more competition in insurance. And so when you think of the two plans, I don't think you want to think so much that we disagree fundamentally on everything, but that we start from a shared perspective. But how do we get from here to there? That's where we don't agree. And the McCain campaign's view, Senator McCain's view, is that the way to get from here to there is by more reliance on markets. The Obama campaign's view is the way to get from here to there is more reliance on government. The center of the McCain plan, the key piece of the McCain plan, is to change a sort of obscure feature of tax law that lets everybody who has employer-sponsored insurance exclude from their taxable income the value of the insurance that they get. Well, what's the consequence of this little piece of tax law? The consequence is that when people shop for insurance, when their employers shop for insurance, they weigh the benefit of a fancier insurance plan against 70, 60, or maybe even 50 cents of the cost. And the reason is because that compensation that the employer pays the employee isn't taxable, they don't weigh the full benefits and costs of the insurance that they try to obtain. The consequence of that, not surprisingly, is the cost growth that we now suffer from. The first thing that has to be done to deal with the cost growth is to change this feature of tax law. And that's what the McCain campaign is going to do. We're going to swap out the employer exclusion and replace it with a fixed tax credit, $2,500 for an individual, $5,000 for a family. With that tax credit, people and their employers will now compare dollar for dollar the extra cost of the insurance that they buy to the benefit that they get from it. That's why this is a good idea. Another reason why it's a good idea is because it's a progressive change in tax policy. When you swap out a deduction is worth more to people with higher income. A credit is worth the same no matter what your income is. When you swap out a deduction and replace it with a credit, that's a progressive change in tax policy. The people who are going to pay more from having a credit are going to be high-income people and people with fancy insurance. The people who are going to benefit from the credit are low-income people and people with restrictive insurance. This idea of having a credit instead of a deduction has been around for a long time. It's not a new idea. And in fact, again, one of Senator Obama's advisors, Jason Furman, his chief economic advisor, just in February wrote a paper talking about all the virtues of tax credits. And so I think that it's that we sort of differ on. The first thing we got to do, get costs under control, and with that, we will be able to get the uninsurance problem under control. Without it, there's really no hope.